Each year, thousands of people lose their limbs because of peripheral arterial disease. My next guest says it doesn't have to be that way, and a simple screening can help you find the right treatment. Dr. Andrew Martin is with Humble Vascular Surgical Center. Good morning.
Good morning, Deborah.
All right, I want to point out this is a certified ambulatory surgical center that specializes in treating vascular disease. So you all are going to know much more about this than maybe some other places people have been going.
That's correct. It's a brand new state-of-the-art center. Our goal is to find people who have blocked arteries in their legs and open them back up again and get them moving again, prevent amputation, and allow people to get back to living a better quality life.
What would be the symptoms of peripheral arterial disease?
Usually it's difficulty walking. People who find that they have to hold on to the grocery cart in the store just to make it through the store, or their legs hurt or just don't work as well as they used to. A lot of times it's diabetics who have some degree of nerve damage as well. They may not even realize that they're not as active as they used to be, or exactly why. And if that's due to blocked arteries, we could fix that. And it's the time to find it is before they develop a problem. So often we'll see that someone will develop a wound that won't heal, and they'll end up either losing their leg or almost losing it, when we could have helped them if we had found them a little bit earlier.
Yeah, diabetes, the number one reason for amputations, about 200,000 amputations every year in this country alone. That's why it is so important to get that second opinion. And as you mentioned at Humble Vascular Surgical Center, if you get in earlier, you can avoid a lot of that.
Absolutely. It's amazing how often we find that people had no idea that they had blocked arteries in their legs. Here's some examples of some patients that we've treated. You see the image on the left that shows an almost totally blocked artery. And if we find it early enough, it's pretty easy to fix and get a great result like that.
Yeah, and a lot of people have seen their parents and grandparents go through something like this. What they don't realize is that the technology has changed.
It keeps getting better and better every year. It's really amazing. Things that we wouldn't even have attempted 15 years ago, we do now commonly. Some of the new devices do an excellent job of cleaning out the artery so that when we use a balloon to open it up, we get a great result and we don't have to use stents very often. And it's really rewarding when we can clean something out. This is the Phoenix device. This is a very nice device that cleans and removes the debris from the artery rather than sending it downstream. There's another one. This is the CSI device that works really well on calcified vessels and allows us to get much better results than we used to get.
And so when you have this procedure done, can you just basically, after this, what's the recovery like?
It's very short. It's an outpatient center, so the recovery time is usually about 2 hours. You're out for the rest of the day pretty much, but you don't have to go into the hospital. The hospitals are very busy right now with COVID, and a lot of the ICUs are filled. So it's great that we can keep people out of the hospital and yet address these difficult problems and keep them on their feet without having to spend time in the hospital.
Yeah, and of course you all are following all those COVID guidelines by the CDC as well, because you are a medical facility, so you get that part. There are also some things that we can do on our part to help avoid this. Stop smoking's one. What are some of the other things?
Well, diet's very important as well. Stop smoking, get some exercise. And we've all been told, control your cholesterol. Most people think that means removing fat from the diet. It's a little bit more complicated than that. Increasingly, we're seeing how a low sugar ketogenic diet can really be helpful in controlling triglycerides and fats in our body. And that's a lot of what causes vascular disease. So a whole foods, plant-based diet, even a ketogenic, low sugar diet makes a huge difference.
Yeah, the bottom line is you don't have to lose your limbs. So get your legs screened. And as you mentioned earlier, sometimes you may not even realize there's a problem. So you can fix those blockages before they're not fixable, because there is a point where you can go too far, right?
Absolutely. So often people either don't notice or they assign it to something else, and before they know it, they've got a problem that could cost them their leg. And it's a very quick and easy screen to check people's pulses. And if they're abnormal, we'll do an ultrasound. And if that shows us that there's a problem, we can do an angiogram and fix it and open it back up again and keep people out of trouble. And once the arteries are totally blocked, it's a lot harder to fix them, and they're much more at risk. And so we can find them early and keep them open, we have much better results.
Yeah. Don't put it off. Okay. You can call the Humble Vascular Surgical Center. As we mentioned, you all are tops in the field in this area. Thank you very much. Humble Vascular Surgical Center has a special offer for Great Day Houston viewers who suspect they have peripheral arterial disease. Throughout January, get free leg screenings when you mention Great Day Houston. Again, this is for people who most likely have peripheral arterial disease and you have some of the issues that we spoke about. Give them a call at this number right here, 346-616-5862. Again, it's 346-616-5862, or visit them online at humblevascularsurgicalcenter.com. Avoid an amputation. That's something that might not need to happen. So get up and get walking pain-free today. We'll be right back.